Right now, in your medicine cabinet, sits a combination that's quietly creating one of the most dangerous threats to human health. No, it's not expired medication or some rare drug interaction. It's something far more shocking. Your everyday painkillers are literally training bacteria to become superbugs. Tylenol and Advil, the medications millions of people take every single day, are accelerating antibiotic resistance in ways scientists never imagined. And the most terrifying part? We're just now figuring out how. Welcome back to Mind and Marvel, where we explore the discoveries that are reshaping our understanding of health, science, and the hidden dangers lurking in plain sight. Today we're diving into research that could change how you think about the most common medications on Earth. Every year, billions of people reach for ibuprofen or acetaminophen. That's Advil and Tylenol to most of us, for headaches, muscle pain, or fever. These medications are so common, so trusted, that we barely think twice about taking them. They're available without prescription, sitting on pharmacy shelves and in kitchen cabinets worldwide. But groundbreaking research from the University of South Australia has just revealed something that should make us all think twice. These innocent painkillers aren't just relieving our symptoms, they're actively helping bacteria become resistant to the antibiotics we depend on to save our lives. We're not talking about some theoretical future threat. Antibiotic-resistant bacteria already kill 1.27 million people every year. That's more than malaria, more than HIV, more than many cancers. And according to this new research, every time someone takes ibuprofen or acetaminophen alongside an antibiotic, they might be making this crisis worse. This isn't about fear-mongering or telling you to throw away your medicine cabinet. This is about understanding one of the most surprising and dangerous unintended consequences in modern medicine. By the end of this video, you'll understand exactly how your pain reliever is inadvertently training bacteria to survive our most powerful antibiotics. Why this discovery changes everything we thought we knew about drug interactions, and what this means for the future of medicine itself. Let's start at the beginning. How this discovery was found. Let's start with how scientists made this shocking discovery. Because sometimes the most important breakthroughs happen when researchers are looking for something completely different. Associate Professor Rieti Venter and her team at the University of South Australia weren't originally studying painkillers. They were investigating something that's been keeping healthcare professionals awake at night: the growing problem of antibiotic resistance in aged care facilities. Picture this. You're working in a nursing home, and you notice that residents are getting infections that used to be easily treatable with standard antibiotics. But now, these same antibiotics aren't working like they used to. Urinary tract infections that should clear up in a few days are persisting for weeks. Skin infections are becoming stubborn and dangerous. This isn't unusual. It's happening in aged care facilities around the world. Older adults are particularly vulnerable because they often take multiple medications simultaneously. We call this polypharmacy, and it's incredibly common in residential care. Think about it. An 80-year-old resident might be on blood pressure medication, diabetes drugs, cholesterol reducers, sleep aids, and pain relievers, all at the same time. For years, scientists assumed that drug interactions primarily involved how medications affected each other's absorption or metabolism in the human body. But Dr. Venter's team asked a different question. What if these non-antibiotic medications were directly interacting with bacteria? What if the drugs meant to help humans were also affecting the microbes trying to infect them? To test this, they set up what sounds like a simple experiment, but was actually incredibly sophisticated. They took E. coli bacteria, the common bug that causes urinary tract infections and food poisoning, and exposed them to ciprofloxacin, a widely used antibiotic. Ciprofloxacin is what doctors call a broad-spectrum antibiotic. Think of it as a powerful general-purpose weapon against bacteria. It's commonly prescribed for skin infections, urinary tract infections, and gut problems. Under normal circumstances, ciprofloxacin does its job well. It targets bacterial DNA, preventing the bacteria from reproducing and eventually killing them. But the researchers wanted to see what happened when they added common non-antibiotic medications to the mix. They tested 9 different medications commonly used in aged care: ibuprofen for pain and inflammation, acetaminophen for pain and fever, diclofenac for arthritis, furosemide for blood pressure, metformin for diabetes, atorvastatin for cholesterol, tramadol for severe pain, temazepam for sleep, and pseudoephedrine for congestion. What they expected was maybe some minor interactions, perhaps some medications making the antibiotic slightly less effective. What they found was absolutely stunning. When bacteria were exposed to ciprofloxacin plus ibuprofen or acetaminophen, something extraordinary happened. The bacteria didn't just develop normal resistance, they went into overdrive. Think of it like this. Imagine you're playing a video game where you're fighting monsters. Normally, when you use a powerful weapon, most monsters die, but a few might develop resistance to that specific weapon. That's manageable. But now imagine that every time you use your powerful weapon, you accidentally give the monsters a super serum that makes them stronger, smarter, and resistant to multiple weapons you haven't even used yet. That's essentially what ibuprofen and acetaminophen are doing to bacteria. The most shocking part? When researchers used ibuprofen and acetaminophen together, the effect was even stronger. The combination was like giving bacteria a masterclass in survival. This wasn't a small effect they had to squint to see. The difference was dramatic, measurable, and reproducible. Every time they ran the experiment, the results were consistent. Common painkillers were turning regular bacteria into superbugs. But the discovery raised an even more important question. How exactly were these painkillers helping bacteria become resistant? The answer would lead researchers into the fascinating and terrifying world of bacterial self-defense mechanisms. To understand how painkillers are accidentally helping bacteria, we need to dive into the microscopic world where one of nature's most sophisticated arms races plays out every day. This is the story of how bacteria have evolved incredible defense mechanisms and how our painkillers are inadvertently giving them an advantage. The first line of defense is what scientists call efflux pumps. Think of these as incredibly efficient evacuation systems. When toxic substances, like antibiotics, get inside the bacterial cell, these pumps work overtime to push them back out. It's like having super-powered vacuum cleaners that can identify poison and suck it out of your house faster than it can do damage. Under normal circumstances, some bacteria have naturally more active efflux pumps than others. This natural variation means that when antibiotics are used, the bacteria with better pumps survive while others die. It's basic natural selection in action. But here's where the story gets fascinating and terrifying. Dr. Venter's team discovered that ibuprofen and acetaminophen are directly activating these efflux pumps, making them work harder and more efficiently. It's as if the bacteria's vacuum cleaners suddenly got turbocharged. Antibiotics that should be able to accumulate to deadly levels inside bacterial cells are being pumped out faster than ever before. But the efflux pumps are just the beginning. The research revealed that painkillers are also affecting what's called the SOS response in bacteria. This is literally the bacterial equivalent of the emergency alert system. When bacteria detect that they're under life-threatening stress, like being attacked by antibiotics, they activate their SOS response. This system does something remarkable. It deliberately increases the bacterial mutation rate. Think about this for a moment. When bacteria are dying, they essentially say, if we can't survive as we are, let's rapidly try different genetic combinations until we find one that works. Most of these rapid mutations will be useless or even harmful to the bacteria. But in a life-or-death situation, the small chance that one mutation will provide antibiotic resistance is worth the risk of producing many failed variants. Under normal antibiotic treatment, some bacteria activate this SOS response and occasionally get lucky with a resistance-conferring mutation. It's a numbers game, and usually, the odds favor the antibiotic. But ibuprofen and acetaminophen are tipping the scales. The research showed that these painkillers are making bacteria more likely to activate their SOS response, and they're making the mutation process more efficient. The researchers were able to identify the specific genetic pathways that ibuprofen and acetaminophen activate. These aren't random effects. They're targeting precise molecular mechanisms that bacteria use for survival. Acetaminophen works through slightly different mechanisms, but with similar results. It affects bacterial metabolism in ways that seem to give bacteria more energy and resources to devote to survival and mutation. When both drugs are used together, they're hitting bacterial cells through multiple pathways simultaneously. It's like providing comprehensive support to help bacteria survive antibiotic treatment. But perhaps the most alarming discovery was that bacteria developing resistance through this process don't just become resistant to the original antibiotic. They develop what scientists call cross-resistance, resistance to multiple antibiotics from different drug classes. This happens because the survival mechanisms that painkillers are enhancing, efflux pumps, DNA repair systems, stress responses, are general-purpose tools that work against many different antibiotics. The bacteria become broadly more capable of surviving antimicrobial assault. This explains why the researchers observed resistance developing to antibiotics the bacteria had never even been exposed to. The painkillers were essentially providing advanced training in general survival skills. The implications are staggering. Every time someone takes ibuprofen or acetaminophen while also taking antibiotics, they might be inadvertently running a training camp for superbugs. Now we need to talk about where this discovery matters most, and it's a place that hits close to home for millions of families worldwide. Aged care facilities have inadvertently become ground zero for one of the most dangerous unintended consequences in modern medicine. Margaret starts her morning with a carefully organized pill dispenser. She takes atorvastatin for her cholesterol, metformin for her type 2 diabetes, furosemide for her blood pressure, and acetaminophen for the arthritis pain in her hands. By lunch, she might need ibuprofen for a headache. Before bed, she takes temazepam to help her sleep. This is what we call polypharmacy, multiple medications taken simultaneously, and it's incredibly common among elderly residents. Here's what makes this situation particularly dangerous. When Margaret develops a urinary tract infection, which happens frequently in aged care, her doctor prescribes ciprofloxacin, the same antibiotic used in the University of South Australia study. Now, Margaret's system contains not just the antibiotic meant to fight her infection, but also the painkillers that, according to this new research, are actively helping bacteria become resistant to that very antibiotic. In a typical 100-bed aged care facility, you might have 60, 70 residents taking acetaminophen or ibuprofen regularly, and 15, 20 residents on antibiotics at any given time. The overlap is enormous. This creates what researchers are calling the perfect storm for antibiotic resistance development. You have a population that's particularly vulnerable to infections, taking medications that accidentally promote bacterial resistance in an environment where infections can spread between residents. Let's break down why aged care residents are so vulnerable. First, aging naturally weakens the immune system. Second, many residents have chronic conditions like diabetes or kidney disease that further compromise their ability to fight infections. Third, the close living quarters and shared facilities in nursing homes mean that resistant bacteria can spread rapidly from person to person. The consequences aren't theoretical. Aged care facilities worldwide are reporting increases in treatment-resistant infections. What used to be simple urinary tract infections now require hospital transfers and intravenous antibiotics. The most heartbreaking aspect is that much of this might be preventable. The painkillers that are contributing to resistance development are often used for chronic conditions that could potentially be managed through other approaches. The discovery about painkillers and antibiotic resistance isn't just about aged care. It's a window into a much larger problem that affects all of us. This research is forcing scientists and doctors to completely rethink how medications interact, not just with each other, but with the microscopic ecosystem that lives in and on our bodies. Let's start with the immediate implications. If common painkillers can help bacteria become resistant to antibiotics, what other everyday medications might be having similar effects? Dr. Venter's team tested 9 different medications, but there are hundreds of commonly prescribed drugs. Blood pressure medications, antacids, antihistamines, psychiatric medications, diabetes drugs. We simply don't know yet how many of these might be inadvertently contributing to antibiotic resistance. This represents a massive blind spot in medical knowledge. For decades, drug development and testing has focused on how medications work in human bodies, with minimal attention to how they might affect bacteria. Most people take these medications at home, often while also taking antibiotics for various infections. Every time someone takes acetaminophen for a headache while finishing up a course of antibiotics for strep throat, there's potentially some level of resistance enhancement happening. Multiply this by the billions of people worldwide who use these medications, and you begin to understand the scale of the potential problem. The first and most immediate solution is awareness. Healthcare providers need to know about these interactions so they can make more informed decisions about medication combinations. This doesn't mean stopping the use of effective pain medications, but it might mean timing them differently. Perhaps spacing out painkillers and antibiotics, or using alternative pain management approaches when someone is taking antibiotics. The second major solution area is drug development. Now that we understand this mechanism, pharmaceutical companies can start testing new medications for their effects on bacterial resistance from the very beginning. They could also potentially develop modified versions of existing painkillers that provide the same human benefits without enhancing bacterial survival mechanisms. Imagine painkillers that are just as effective for human pain relief, but don't activate bacterial efflux pumps or SOS responses. This isn't science fiction. It's a realistic goal based on our new understanding of these mechanisms. The third solution involves what scientists call combination therapy, but with a twist. Instead of trying to avoid drug combinations, researchers are exploring whether certain combinations might actually work against bacteria. For example, if we know that certain painkillers activate bacterial efflux pumps, we might be able to develop efflux pump inhibitors that could be given simultaneously. This would block the bacteria's enhanced defense while still providing pain relief. Some researchers are even investigating whether certain drug combinations might make bacteria more vulnerable to antibiotics, essentially turning the resistance enhancement mechanism inside out. The fourth major solution area is personalized medicine. Not everyone responds to medications the same way, and the same might be true for bacteria living in different people. Genetic testing, microbiome analysis, and other personalized medicine approaches might help doctors identify which patients are most at risk for resistance development when taking certain drug combinations. This could lead to individualized treatment protocols, where medication choices are based not just on the patient's symptoms, but also on their likelihood of promoting antibiotic resistance. The fifth solution is improved monitoring and surveillance. Healthcare systems need better ways to track antibiotic resistance patterns and link them to medication usage. Electronic health records could be programmed to flag potentially problematic drug combinations and suggest alternatives. Hospitals and care facilities could implement resistance monitoring programs that track how different medication protocols affect infection outcomes. But perhaps the most important long-term solution is a fundamental shift in how we think about medicine. We need to stop viewing the human body as an isolated system and start recognizing that we're complex ecosystems where everything is interconnected. Every medication we take affects not just our human cells, but also the trillions of bacteria, viruses, and other microorganisms that live with us. These microbes aren't just passengers. They're active participants in our health and disease. This means that future drug development needs to consider these ecosystem effects from the very beginning. We need to ask not just, does this drug help humans, but also, how does this drug affect the microbial communities that humans depend on? The University of South Australia research is calling for exactly this kind of comprehensive approach. They're advocating for studies that look at drug interactions not just between two medications, but among complex combinations that reflect real-world medication use. This is challenging research because it requires expertise from many different fields: pharmacology, microbiology, infectious disease, geriatrics, and more. But it's essential if we want to understand the full implications of our medication choices. The good news is that this discovery represents a major breakthrough in our understanding of antibiotic resistance. For the first time, we have a clear mechanism explaining how non-antibiotic medications can contribute to this global health threat. Knowledge is power, and now that we understand this mechanism, we can start developing strategies to work around it or even exploit it for therapeutic benefit. So what does all of this mean for you right now today? Should you be worried about taking Tylenol or Advil? Should you throw away your pain medications? The answer is more nuanced than you might expect, and it's important we get this right. First and most importantly, do not stop taking medications that your doctor has prescribed without consulting with them first. The University of South Australia researchers were very clear about this. Their findings don't mean these medications should be avoided entirely. What these findings mean is that we need to be smarter about how and when we use these medications, especially when antibiotics are involved. Think of it like learning that certain foods don't mix well together. You don't stop eating, you just become more thoughtful about combinations. If you're currently taking antibiotics and you need pain relief, this might be a good time to discuss alternatives with your healthcare provider. Can you use heat or cold therapy? Would topical pain relievers work? Are there timing strategies that might reduce risk? For most healthy adults who occasionally take these medications, the risk is probably relatively low. The most concerning scenarios involve people who take multiple medications regularly, particularly elderly individuals in care facilities who might be on several drugs simultaneously. But this research does highlight something crucial for all of us: the interconnected nature of health in our modern world. Your individual medication choices don't just affect you, they potentially affect the bacterial ecosystems that we all share. When bacteria develop resistance in one person, those resistant genes can spread to bacteria in other people through various routes: direct contact, shared environments, even through food and water systems. This makes antibiotic resistance what epidemiologists call a collective action problem. Even if you personally are careful about antibiotic use, you can be affected by resistance that develops due to other people's medication choices. That's why this research is so important. It's not just about individual health decisions. It's about public health policy and how we approach medication use as a society. Healthcare systems worldwide are going to need to update their protocols based on these findings. Medical schools will need to teach future doctors about these previously unknown interactions. Pharmaceutical companies will need to expand their testing procedures, but there's also reason for optimism. This discovery opens up entirely new avenues for combating antibiotic resistance. Once we understand a problem mechanism, we can work to counteract it. Scientists are already investigating whether certain supplements or medications might block the resistance-enhancing effects of painkillers. Others are exploring whether probiotics or other microbiome interventions might help maintain bacterial susceptibility to antibiotics. The global health implications are staggering. If we can find ways to preserve antibiotic effectiveness by managing these interactions, we could potentially save millions of lives and billions of healthcare dollars worldwide. This research also highlights the importance of investing in basic scientific research. Dr. Venter's team wasn't trying to solve the world's antibiotic resistance crisis when they started this work. They were investigating a specific problem in aged care facilities. But their curiosity-driven investigation has revealed a mechanism that could affect billions of people. This is how science works at its best, asking simple questions that lead to profound discoveries. It's also a reminder that some of the most important medical discoveries come from studying vulnerable populations. Aged care residents, who are often overlooked in medical research, have provided insights that could benefit everyone. Looking forward, this discovery will likely accelerate research into the broader question of how non-antibiotic medications affect bacterial behavior. We're probably looking at the tip of the iceberg. In the next decade, we might discover that many common medications have unexpected effects on bacterial resistance, viral replication, or immune function. Each discovery will give us more tools to optimize treatment and minimize unintended consequences. As we wrap up this journey into the hidden world of drug interactions and bacterial resistance, let's take a moment to appreciate what we've discovered together and what it means for the future of medicine. We've seen how two of the world's most trusted medications, drugs so common they sit in nearly every medicine cabinet, are inadvertently training bacteria to survive our most important antibiotics. We've explored the sophisticated molecular mechanisms that bacteria use to fight back against our treatments. Most importantly, we've witnessed science doing what it does best, uncovering hidden connections that change how we understand health and disease. This research from the University of South Australia represents more than just an interesting discovery. It's a wake-up call about the complexity of modern medicine and the unintended consequences that can emerge when we don't consider the full ecosystem of health. But knowledge is the first step toward solutions. Now that we understand this mechanism, researchers around the world are working on ways to preserve antibiotic effectiveness while still providing the pain relief that millions of people need. So what can you do with this information? First, If this video opened your eyes to the complex world of drug interactions and antibiotic resistance, hit that like button and subscribe to Mind and Marvel. We're here every week, bringing you the scientific breakthroughs that are reshaping medicine and human health. Second, share this knowledge responsibly. This isn't about creating fear around necessary medications, but about promoting informed conversations with healthcare providers. Share this video with family members who might benefit from understanding these interactions, especially those caring for elderly relatives. Third, use this as a starting point for conversations with your own healthcare providers. Ask about drug interactions, discuss alternative pain management approaches, and make sure your doctor knows about all the medications you're taking, not just prescription drugs, but over-the-counter medications too. Fourth, let us know in the comments what surprised you most about this research. Were you shocked by the bacterial defense mechanisms? Concerned about the implications for aged care? Curious about potential solutions? Your engagement helps us understand what topics matter most to our community. Finally, remember that this story is still being written. Right now, in laboratories around the world, researchers are building on these findings, developing new solutions, and uncovering additional pieces of the puzzle. The future of medicine lies not in avoiding complexity, but in understanding it better. Every time we discover how our treatments interact with the microscopic world around us, we get better at designing therapies that work with our biology rather than against it. This research reminds us that we're not just individuals making personal health choices. We're part of a larger ecosystem where our decisions affect not only ourselves but the microbial communities we share with everyone around us. The 1.27 million people who die each year from antibiotic-resistant infections aren't just statistics. They're parents, grandparents, children, and friends whose lives could potentially be saved as we develop better understanding of how to preserve our most precious medical tools. Thanks for joining me on this deep dive into one of the most surprising discoveries in recent medical research. Until next time, keep questioning, keep learning, and keep marveling at the incredible complexity of the biological world we're all part of. This is Mind and Marvel, where every discovery brings us closer to understanding the magnificent, interconnected web of life, and where science, survival, and the superhuman collide.